Hello, my name is Gina, and over the next few minutes, I will be teaching you how to use the PICO framework. The purpose of this video is to illustrate the benefits of the PICO framework and provide an overview of how it can be applied. What is PICO? The PICO framework is a systematic way to identify important concepts in a case or research. It allows us to zoom in on what is most important when formulating a question. Here are some useful reminders as you use the PICO framework. The goal of PICO is to focus your topic. Your question can always be refined and changed. You may not use every part of the acronym depending on the nature of your research question. PICO is a guideline, but it may not fit perfectly to every scenario. It is up to you how you want to frame your question. PICO is not the only framework, but a great starting place for research at every level. What does PICO stand for? The P in PICO stands for patient, problem, or population of interest. I stands for intervention or treatment. C is comparison intervention. And finally, O stands for outcome. Let's get a little more in depth about what this all means. P can be the patient, problem, or population you are studying. Who is the group you are studying or trying to help with your intervention? I, intervention, is the treatment you are interested in providing. What exposure will you use on your group or patient? An example of this is any type of treatment that may help or benefit your group and remedy a problem identified in P. The comparison is our control group. You should ask yourself, what are you comparing your intervention to? Or, is your intervention the most beneficial to your user group? Finally, outcome, which is what we want to achieve with our intervention. An example of outcome could be improved health or quality of life for our patient, which is the P in PICO. Let's practice. Here is a medical scenario. Emma, 20-year-old female, is suffering from seasonal allergies. She is currently on a nasal spray antihistamine. She wants to know if it is more effective for her to use an over-the-counter oral antihistamine to combat her allergies or to stick with a nasal spray. Let's pinpoint keywords for each piece of PICO. Our P is a 20-year-old woman with seasonal allergies. Our I is the over-the-counter oral antihistamine. C is the nasal spray antihistamine. And finally, O is controlled seasonal allergies. Now let's take our keywords and form a research question. I have our reminders of what our PICO keywords are as identified in the previous slide. Take a moment to think of or jot down a useful research question that uses each aspect of PICO. This is the research question I came up with. Is an over-the-counter oral antihistamine more, less, or equally effective in controlling seasonal allergies as compared to nasal spray antihistamine? Do you see each element of PICO in the research question? Now it's time for a PICO quiz. Fill in the blanks and practice using PICO on your own. In patients above the age of 65, can a shingles vaccination compared to not using a vaccination reduce the risk of contracting shingles? Our questions are, what are the missing intervention and outcome pieces of PICO? The missing intervention is the shingles vaccination because it is what we are giving to our population in order to present a positive outcome. And the missing outcome is reduced risk of contracting shingles. This is the positive life effect we want from our intervention. To wrap it up nicely, the PICO framework is a useful guideline for extracting the most important elements of our research and help formulate focused and useful research questions. Try PICO out for yourself the next time you are overwhelmed by your research and creating a research question. It may help you streamline your research and identify the most important elements of your research. For today's presentation, I cited the following works. Thank you for listening.